Is the voice of Indiana County, WCCS, AM 1160 and 101.1 FM, 845 in the morning. Hey, look across the microphone from me and I see not one Kramer, but two. Good morning, Dr. Ron Kramer and Bonnie Kramer, certified registered nurse practitioner, joining us here on Indiana in the morning. Good morning to both of you.
Good morning.
It's good to have you with us here today. Let's talk about bellies. This time of the year, people fill up their bellies a little bit too much, I think. But you folks, you had this the recent thing. Was it Disobedient Spirits, where you had the gastrointestinal talk with folks to come by and visit with you? Levity. I knew it was one of them. But you had a chance to talk with folks and talk about some of their concerns. So let's share some of those topics and some of the gastrointestinal topics that Ron, we talked about when you first came to visit with us a few months ago. And well, at this time of the year, I don't know that it's really different from other times of the year, but you tell me, do you find more gastrointestinal distress at this time of the year than at other times?
I don't think so.
No?
Not too much.
Yeah, it's fairly common all the time.
Holidays precipitate some additional stress on people, and stress in general makes GI symptoms worse. But I think there's plenty of stress for folks year round.
Yeah, we don't have to assign it just to this time of the year. Let's pull that microphone a little closer to you. It tends to fade away from us a little bit. Bonnie, yours is strong. You have the stronger microphone. Maybe you have the stronger voice in the family too.
It depends.
Undoubtedly.
Undoubtedly, he says. All right, so let's talk about gastrointestinal illnesses, what they are. What are some of the things that you both concern yourself with? And Ron, when you were here before, we were talking about a variety of them, and I think folks might be surprised how broad this whole topic could be.
Top to bottom, literally. So pretty broad. In fact, easier to talk if you get a little more specific about the spot. But fairly broad, sure.
All right. Well, let's get into the colon here, if you will, and talk about some of those colonic disorders that people deal with.
At Levity, you could actually get into the colon.
I heard about that. What was that like? Rather frightening.
We put pictures of our kids up on the line.
Oh, did you really? They're a pain in the colon. Is this what you're saying?
Close.
Basically,
they irritate your colon. But okay, let's talk about some of the problems with the colon that you deal with. Colonoscopies are now a really typical test that is ordered, aren't they?
Yeah, probably one of the more beneficial things you can derive from a colonoscopy is just preventative medicine. Colon cancer starts as little things called polyps. They're benign. It takes them a long time to evolve and grow, like a 10-year time span before they actually turn into a malignancy. So at various ages, people go in and have these done. And if they have polyps, they're taken out and they're preventing something bad from happening down the road.
Yeah, and that's very important because I believe you call it, and Bonnie, you can confirm this too. You said before that that's the one really, really curable, preventable type of cancer.
Definitely.
All right, so
I just heard you doing the sports, and just this morning I turned the TV on. They had this bit on Ed Olczyk, a hockey player.
Yeah,
he had stage 3 colon cancer and had just gone through chemotherapy.
I never heard that.
So it's very much all over the place.
Yeah, Edzo's very familiar around here. He was the head coach of the Penguins for a while after his playing career with the Penguins, and now he's the horse racing analyst for NBC.
But, I didn't know that.
Yeah,
horse racing
on the Kentucky Derby. He's the guy that talks about the odds and how he would bet each race. But those are odds that are really, really improved if you're having those regular colonoscopies. When should people have their colonoscopies? What's the schedule that they should get? And at what age should they start?
It depends on risk factors, but if you're somebody without any risk factors, it's age 50. And a screening test is done when you're not having any problems. It's a screening test as opposed to a diagnostic test. If you've had bleeding or something, then the age thing doesn't come into play. So age 50, for the most part, is
Yeah.
when people get screened with a colonoscopy.
But there are times when you're at an earlier age when you're going to notice things that might make you say to yourself, "I need to get in to see somebody," and a colonoscopy might be something that is beneficial then too. Correct?
And then it's a diagnostic test as opposed to a screen.
Okay, Bonnie, let's bring you in on this conversation a little bit and what you are able to do as a certified registered nurse practitioner, particularly in gastrointestinal areas.
I'm able to do basically see the same things that Dr. Kramer sees. I just don't do procedures. So I can see follow-up patients. I can see some new patients. I can see new patients or new consults in the hospital. So I basically deal with a lot of the same issues, basically the same issues he deals with. Just I don't do the procedures, so.
Do you think people would be surprised to find out the number of ailments that they might have a connection to diseases that you, as someone involved in gastrointestinal illnesses, would say that's a GI problem?
Yeah, we see that too as well, because a lot of the gut, a lot of the potential issues can start there. That's a part, irritable bowel syndrome's a big one too. If people have a lot of anxiety, sometimes we see a pattern with irritable bowel syndrome with that as well, and then the brain-gut connection with that. So
Yeah.
That's just one example.
Yeah. I want to talk about two other conditions that we hear a lot about and how common they are and how treatable they are. The first is Crohn's disease. We see and hear a lot more about that now these days than we have in the past. Let's talk about Crohn's disease from your standpoint, Dr. Ron Kramer.
Some of the symptoms can be identical to irritable bowel. Bleeding's not one of them. Bleeding's never irritable bowel. It's from something else. Again, the right age, the right clinical scenario, kind of red light symptoms like some form of bleeding would warrant additional evaluation in a person. And that usually is some sort of endoscopic procedure. Crohn's is a mucosal problem. Nobody knows why Crohn's happens, but it has something to do with the gut flora and how our immune system reacts to the gut in the flora in an abnormal manner. And Crohn's is kind of a general term, probably for something that has different subsections to it with different types of immune problems that result in inflammation in the mucosa. And then in turn, if that is left unchecked, you can have damage to the lining that results in lots of long-term problems, little tracts that go from bowel to bowel, fistulas, and then generalized, again, the generalized nature of the disease. Everything basically can sort of begin to fall apart on the periphery. So Crohn's is a very treatable entity. It's not a great thing to have, but it's a very treatable entity, and the treatment options are so much broader than they have been in the past.
Yeah. In the past, what was the general approach? Removal of certain sections?
Well, no, never.
Never?
Never unless you absolutely have to,
Okay.
because it's not curable. And you want to keep as much bowel as you can.
Sure.
You have to absorb things. If you take too much bowel out, you can't absorb things, and then you really have a problem. So it's to treat and keep the integrity of the bowel in place. And the approach, they have biologic therapy out now that was a couple of agents, and now it's a big long list of agents. And the agents hit different types of immune reaction problems. So, and then there's different ways to monitor those agents.
Yeah.
So it like a lot of things, has come a long way over, I guess, a relatively short period of time.
Various types of hepatitis also a part of the GI field, are they not?
Yes.
Yeah. So what are some of the things that people will notice that might be an indicator of hepatitis? Because there are all kinds of different types of that as well.
There's acute hepatitis, there's chronic hepatitis, and a lot of times different types of chronic hepatitis are found incidentally. A liver test will be up a little bit, and then subsequent testing you'll find out, for example, that you have hepatitis C. Some people even without any identifiable risk factors. And each hepatitis, whether it's viral or autoimmune or something that's inherited, they all have different treatment forms, and you treat it to prevent chronic liver damage. Problem with liver problems are that most of your liver is in very bad shape before you ever get any type of physical signs that it's that way. So you find a patient, tell them they have, let's say, hepatitis C, and they're confused because they feel fine. But 10 years from now, there may be problems as a result of that.
Is that one of those early diagnosis things where early diagnosis is going to prevent future problems?
You want to, if possible, you want to take care of chronic hepatitis, of whatever the etiology is, as soon as possible to prevent the progression to cirrhosis.
Dr. Ronald Kramer with us, gastroenterology, and his wife, Bonnie Kramer, who is a certified registered nurse practitioner. Bonnie, when people come to visit you folks, is it generally by referral because a primary care physician might have noticed something or another specialist might have noticed something? Or is it something that they say to themselves, I have to go see a GI specialist?
The majority is by referral, physician referral, either PCP or even, hematologist, whatever. But we've gotten some self-referrals too, actually. So, but the majority is, family practitioner referrals to us with problems and things like that.
And you're working out of the same office?
Correct.
Yeah, okay. Pretend he's not here. How he is as a guy to work with?
Actually, we've been working together off and on for 17 years.
Oh, yeah?
Yeah, we had our own, he had his own private practice, and at that time I was the nurse office manager, wore many hats at that point. And then when I went back to school then, kind of broke up there for a little bit as far as treating people together. But then now that we're back here, we're back together again, and it works pretty well.
I would guess that's a great collaboration because you know each other very well, obviously, but you know your way around the gut. if you will. So Ron, how's Bonnie to work with? We'll pretend she is in here.
She is.
Good point. Good point.
A lot of what we just talked about, these conditions and things, we don't expect people to have a good understanding when they leave. It's just so much information at one time. So a nurse practitioner is so valuable in follow-up visits and in phone calls and in education, so that people have a much better understanding of what they're going through, and then they have a much easier resource to tap into. There's a lot of value to nurse practitioners, but helping people understand what they're going through is a real big plus of what they do.
That'd be a key. It really would be.
And she's okay to work with.
She is.
Yes, I don't.
By comparison, and you don't have a whole lot by comparison. There, you can find them in the IASA building, 888-452-IRMC. That's the phone number, 888-452-IRMC. You can also go to irmcdocs.org. Dr. Ron Kramer, Bonnie Kramer, CRNP. Thanks for being with us this morning.
Thank you very much.
Thank
We
you very
appreciate
much.
it. It is
Now
the
let's
voice.
thank Annie Rizzo for setting this up.
Hey, Annie. There's Annie. We don't get Annie on camera all that much, and you can tell how much she loves being on camera. So there she is. You can check her out on Facebook, along with the Kramers. It's Indiana in the Morning here on the Voice of Indiana County, WCCS.